Dr. Pauling, you have talked about missing teeth and how important it is to replace them, because slowly and very gradually, in fact, in this case, the slow and gradual is probably a handicap, because we people don't notice it, so we don't pay attention to it till it is too late. Almost like with gaining weight, you gain a half a pound every half a month or months, and that's fine, and it's no big deal. 25 years later, all of a sudden you are a bowling ball, and you're cannot move, and you have diabetes and all kinds of stuff. It adds up, and at that point it's too late to go back. So you talked about that. Now, what are some of the options a person has these days to, the main options a person has to replace such a missing tooth?
Well, really the standard of care for treatment for a missing tooth is shifting towards dental implants. And a dental implant will replace the root of the tooth, and then a crown is placed on top of that implant. Other options, there's actually quite a big range. They include a fixed bridge or a removable denture as some other options. But really the best thing is dental implants.
Okay, let's fast a little bit summarize each one of them is. So an implant is a metal screw. It's like made out of titanium, like a hip operation. When you get a hip operation, which gets put in, and then you put in a crown on it, right? That's kind of the implant, right?
Yes, and it integrates into the bone, and it's the thing that's most like the natural tooth that was lost.
Mm-hmm. And one of the reasons is because when you have a missing tooth and the root is gone, apparently the bones start shrinking and shrinking and shrinking, and that's why our grandparents who didn't have that, they have those, faces which look like dried out tomatoes and flat and whatever, because their bones started shrinking because the root was gone. Is that the phenomenon of it?
Yeah, when your teeth really keep the bone there, and a dental implant can do the same thing. They maintain bone by placing that dental implant in there. It's just our body recognizes there's something there and recognizes that the bone needs to be there to support it.
Yeah, I guess that's important. Our whole body is geared towards, if you get I remember as a kid, I broke my arm in skiing, I think, and anyway, there it was 6 or 8 weeks in a cast, and boy, that hand was thin and weak, and I could barely lift a coffee cup after that,
That's right. Yeah.
And so the whole body is geared towards, if you don't use it, you lose it, basically.
That's right. Use it or lose it.
What about the crown or the bridge? You said the bridge. So
bridge.
How exactly does that work, and why is it not anymore because bridges have been around for a long time and they apparently served us very well. So give us the small, first of all, tell us a little bit, how a bridge is composed of, and then a little bit why a bridge might not be as good as a thing as an implant.
Well, a bridge works like, just like the name sounds, that it's supposed to span a gap, to replace that area to where there's nothing there. Just like a bridge going over a river replaces the road that can't just go across the river. It's basically, we make a crown for the tooth on either side of the missing tooth, and those two crowns are fused together with the tooth in the middle that replaces that. So it's kind of a triple crown.
You have the two teeth, you put a crown on it, and you hang a third one in between, or even two ones in between.
That's right.
And in order to do that, to put a crown on it, you need to grind down those two teeth in order to put the crown over it, which basically means you weaken the tooth, right?
That's exactly right. It's one of the main disadvantages of doing a bridge is that you have to lose tooth structure from teeth that might otherwise be healthy or not need to be ground down as much to be able to put a bridge in place. Another one of the big disadvantages of a bridge compared to an implant is that it's harder to keep them clean because the teeth are all fused together. You can't get in there with floss as easily to keep your natural teeth clean. And also they don't have...
So if you can't keep them clean, especially at the bottom, right, like around the gum, not keeping a tooth clean, really that means developing gum disease. And gum disease in itself will eat away the bone, the flesh, and more importantly, or similar importantly, poisons the body. And then we have talked in another video on how devastating it does actually poison the body. That's just incredible, from liver to kidney to heart to brain to diabetes to babies which are maybe perhaps premature born and underweight. I mean, the list is long.
Right.
So you're risking that with it.
That's right. You have a higher risk for having periodontal disease, which has all those effects that can have all those effects that you listed, and making them harder to clean makes them more susceptible to further decay and possibly losing those teeth that are supporting the rest of the bridge.
Right.
So it's just kind of a harder situation on the teeth. Bridges are good and they still have a purpose in dentistry, but that's just why we prefer to do a dental implant in this day and age.
Right, because if and when that bridge fails because of, let's just say, disease or whatever it might be, or let's say one of the tooth breaking because of the weight it has and it was a cut down tooth, you now need to replace again all four of them. You now have more to replace, right? You cannot just replace one little thing. It's the whole thing which fails.
That's right.
Right, I got it. So, but let's just say, you said that depends on the teeth. Let's assume those two teeth, here's a missing tooth, and those two teeth already have problems. They already need work. Would it then be a good time to put a crown or a bridge on it?
That definitely becomes a more reasonable option when the teeth around need other dental work. If the both teeth on the other side already need crowns, a bridge is a very reasonable option. It's still going to be more difficult to clean than the dental implant would be, but it doesn't have the disadvantage of losing healthy tooth structure. So it does make it a reasonable option.
I got it. Well, Dr. Pauling, tell me, you may not have 100% number, because I'm sure in the whole world there are no 100% number. Anybody who thinks that there is something which is always the same way and that's how it has to be and I have a right to it, well, it doesn't work that way. But give me a good average here. Is there data out there, proven data, because of implants have been around now for, well, at least a good 20 years, probably 30 years, but for 20 years they're pretty good, and I'm sure they improved over time. Is the data out that on an average an implant just simply lasts a lot longer than a crown, or not really, or is it a toss-up, or what are we talking about here?
The general research shows that an implant will last longer than a 3-unit bridge. That's definitely has been established in the dental literature. So it is a better long-term solution, and implants have been around long enough that they do have a track record. Not a track record as long as fixed bridges, but definitely one that you can feel very confident and comfortable having dental implants placed.
Right. And having, as you said, not having the potential, which doesn't have to come, but the potential of easier developing gum disease and all that stuff, or other things. Now, let me ask you one more question here. Because price, especially in these days, is always an option. I mean, maybe all of us would like to travel in a Rolls Royce, but we gotta, go with the normal car. Maybe not. But the point is, price is an option. So, And you, no matter what we say, like, well, this is your health, well, that's fine if the money isn't there. But you see what I'm saying? So we need to then go for the next best option. But let me ask you, you have a 3-unit bridge, sometimes a 4-unit bridge. Anyway, let's take a 3-unit bridge. You do 1 implant, 1 crown. On a 3-unit bridge, you need to have 3 crowns. Wouldn't the price be more or less almost offset by having 2 more crowns to do? They're not cheap.
They're not. It definitely is going to be comparable in price to doing 2 extra crowns, and is going to be comparable to the price of placing that implant. It's probably still going to be a bit more expensive to go with the implant, but I think that the benefits are much higher.
Right. Oh, wonderful, but it's definitely not that huge amount of more. You know what I'm saying? It looks like. I mean, yeah, absolutely.
Definitely not.
Well, wonderful. And those are definitely the 2 main things. And you do say that when there is maybe more teeth missing, maybe some partial dentures. We're going to talk about this a little more. But obviously, overall, people want to stay away from anything removable because removable is removable. It just doesn't quite fit that well, and you want to have something which is fixed and steady so you can bite into an apple and chew on a prime rib, I guess, right?
That's right. And with dentures, you have to cover more of the mouth than you would ever have to cover with a fixed restoration. The removable restorations are going to have to cover your gums some, and they have clasps to go on your other teeth and things like that, which make them possibly a little bit more uncomfortable.
Right, and not be able to taste the foie gras or for that much the spaghetti sauce, and that's pretty that must be awful. Imagine you eating spaghetti sauce with meatball and you can't taste the meatball. I mean, that's just bad. That's just not good. That's not right. All right.
That's a shame.
That's a shame. Well, Dr. Pauling, thank you very much. Very informative. Thank you very much.
My pleasure.